Our next speaker is Dr. Elizabeth Garner, Chief Scientific Officer of Ferring Pharmaceutical. Everybody knows what the pharmaceutical industry did for us. We just came off the pandemic, right? The worst nightmare that anybody can ever live. And she's also the president of the American Medical Women's Association. Let's greet Dr. Garner. Elizabeth?
All right, I'm going to be so not a TED speaker here because I'm going to be using my script. Sorry. All right, so as you heard, my name is Beth Garner. Sorry, I'm just setting my little stopwatch so I don't go too far over. So great to see all of you. So Beth Garner, I'm the scientific officer in the US for a company called Ferring Pharmaceuticals. We are a global, mid-sized pharma company. We have a number of different products, including women's health and fertility, gastroenterology, orthopedics, and uro-oncology. So a number of different therapeutic areas that we work in. You also heard that I'm also the current president of the American Medical Women's Association, and this is the oldest organization for women's physicians in this country and probably in the world, actually. And our mission as an organization is to advance women in medicine, to advocate for equity, and to ensure excellence in healthcare. So those are the three pieces of our mission. So today, I'm really here to talk about leadership as well, and specifically about the fact that although I think it's amazing, that in the last decades we have more and more women leaders, right, as is evidenced here today. But, in my opinion at least, we aren't there yet. We have a long way to go. And I'm going to talk about how that, at least in my opinion, leads in directly and impacts women's health. So it's sort of like, how does that quite go together? But hopefully in the next 15 minutes, I'll make that clear. So first, just a little bit of background on myself and why I'm so very, very passionate about women and about women's health. So you'll be a little bit surprised that actually I was born in Nigeria. I'm the daughter of a white American Peace Corps volunteer and a Nigerian electrical engineer. And 11 days after I was born, way back in 1967, if you can believe it, I am that old, the Biafran War started. So I'm 11 days old, and here this war breaks out. So of course we ran to the rural parts of Nigeria, where my father was actually from. And then a year later, as the situation continued to worsen, my mother, me and my elder brother were flown out of the country as war refugees and came over to the US. We lived in the US until the war ended in 1970, and then we actually returned to Nigeria, which is where I was born and raised. I then came to the US for college. I attended a women's college, my mom's actual alma mater. Now you can imagine my mom encouraging me to go to that college. She's also a very, very staunch women's advocate and women's supporter, so I learned clearly from her. And then after college, I went to medical school. I was fortunate enough to get into Harvard Medical School. I trained in obstetrics and gynecology and gynecologic oncology there. And then went on to practice. So clearly, having picked obstetrics and gynecology and women's oncology, you can see from the very beginning I was very, very passionate about women's health specifically. So my career as a practicing physician was really shaped not as much for the experiences here, but really the experiences that I had growing up in Nigeria, right? Where I had seen just crazy, right, sad, avoidable suffering and loss due to lack of reliable, available, safe health care. And women in particular suffered, I would say, exponentially more, largely to having, to deal with pregnancy and childbirth and all of those complications that come along with it. Now, unfortunately, I think back then maybe we didn't recognize, but certainly today, we see these same problems right here in the United States for women. Right, we have a healthcare system that certainly for women, and particularly for women of color, is really failing in many, many ways. Back to when I was in clinical practice, I had continued to wonder, how can I have wider impact? I love taking care of patients, loved it. But it was kind of one patient at a time that I could help, right? I really wanted kind of a broader impact than that. And I wasn't doing much about that, but suddenly out of the blue, I got an email from Merck asking whether I would want to look at possibly working on the HPV vaccine, which was being developed at that time. So you can imagine, here I am thinking, well, what can I do to sort of do something bigger for women, for women's health? That was clearly for me the opportunity, right, to use my clinical expertise to have that much wider impact that I was looking for. So ultimately, I did join Merck, and over the last 16 years then, I've worked with 6 different companies, and I've just been very, very lucky to really see a number of women's health products come to market. Been very, very fortunate. And then more recently, as I've gotten into more senior positions, I've also been able to join some corporate boards, which is very nice because that allows me to have even greater influence and impact, which is, at the end of the day, always what I'm looking for. Okay, so let's turn to the issue at hand today, which is, again, why we need more women in leadership, and for me, why we're not quite there, because I believe we need many, many more women in the very, very top levels in business. So I'm talking about CEOs of healthcare industries, CEOs of pharma companies, CEOs of academic health centers, CEOs of insurance companies, CEOs of investment firms, all the parts of the healthcare ecosystem. We need women at the very top. And why is that? Well, because no matter what, we all have to admit that yes, a board is a board, but ultimately when there are really tough decisions to be made, who is it that finally makes that call? It's the chair, right? And who is it for a company when things are really challenging and there's debate on what to do next? Who makes that final call? It's the CEO. For investment as well, I used to spend a lot of time in front of investors in my last 2 companies. I would get very excited when there was a woman investor sitting there listening, and then I would realize, oh, she's not the one who's making the decision, right? It's some guy who's ahead of her, above her, and doesn't understand this women's health thing. So for me, it's that we've got to get women at the very, very, very top. And like I said, women are achieving great entry into leadership and C-suite positions even, but for me, that's not enough, right? Because we need the top decision makers. And there, we definitely continue to lag. So what I hope, and my hypothesis here, is that with more women deciders at the top, we will be able to deal with some of the key issues that women face on a daily basis, right? Because I believe these women at the top will understand the impact on quality of life for women, all the stuff you were talking about. And I'll also understand the business benefits, right, of having healthier women. I think you were talking about that as well. And healthier moms at work, right? So critical. All of this supports, ultimately, women's health. So let's just get into some of the data on the status quo regarding women in top leadership positions. We'll look at CEOs, we'll look at investment banks, boards of directors, and so on, academic medical institutions, the stuff I was talking about already. And to me, like I said, all of these categories I think are critical, right, in terms of improving upon the issue of healthcare. So let's start with CEOs. So we're going to just put some numbers out. So I'll start broadly here, beyond the healthcare industry, because I think Fortune 500 companies really serve as a microcosm, right, for what's happening in business at large. So looking at the numbers of women running the Fortune 500 companies, I think is helpful. So just this January, for the first time in the Fortune 500 list, 68-year history, more than 10% of companies are led by women. So that's a great, great, great news. That said, there's still more than 10 times as many companies run by men as compared to women, and we're 50% of the population. When it comes to women of color, only 4 out of 500, only 4 have ever been CEOs of a Fortune 500 company. And unfortunately, we just lost one of them, one of the remaining 2. Black leaders with the departure of Rosalind Brewer, who just stepped down from Walgreens earlier this month, right? So, and that was only after 1.5 years on the job. So, women, the retention thing is really a big issue as well. So now we have one black woman, Thasunda Duckett from TIAA. So that's Fortune 500. All right. If you look at the 10 Top pharmaceutical companies in the United States. Okay, so Pfizer, AbbVie, all the big names that you know, one has a female CEO, and that's Emma Walmsley of GSK. So not doing so well, right? So, but if you look at any of those companies, you'll say, but wait, there's so many women leaders. There's VPs, there's executive VPs. Yeah, but the numbers at really the top are still very, very minimal, very low. All right, let's talk about CEOs of hospital systems, health insurance CEOs. Those are the ones, people who decide, right, on where do the healthcare resources go? Do we open a women's health unit versus, orthopedics or whatever? They decide what departments get funding. Insurance CEOs decide at the end of the day, what are we going to pay for women's health and various conditions of women's health. So in a study published by JAMA Network a couple of years ago, only 15% of the CEO roles in health systems and only also about 16% of CEO positions in health insurance groups were held by women. So again, really, really small numbers. Not surprisingly, organizations that have senior leadership with gender diversity, right, where you've got a lot of gender diversity going on at the senior levels, they're more likely to have a woman as a CEO naturally, right? Okay, let's look at board chairs. I mentioned board chairs earlier, also extremely important. These are people who make very key decision makers for healthcare companies. And there's a Fortune article from several months ago that reported that although women comprise 27% of board directors, at Russell 3000 companies, only 7% are board chairs. So again, we're sort of still under 10 for most of these, right? Heads of investment banks and venture firms. Critically important to healthcare industry, right? They give, especially smaller companies, the investments that they need to be able to develop the therapies and the solutions that they want. In 2022, for fundamental positions in financial services, there were only 9% of women as chief investment officers, so they're the ones making decisions, 9% for head of research, 0% for the head of investment banking. So the person who's going to make that call in the end, right? So again, still so much work to do. So a little bit more specific just to health, let's look at academic medical institutions. These roles are very, very important, of course, right? Because deans decide, what students are going to be looking or learning about, and medical school leaders, the top of leaders decide again around departments and so on. And so 15% only of academic medicine departments are led by women, and only 16% of medical school deans are women. So again, it's just still really small numbers. So let's just go then from there, how this affects women's health specifically. So it's been known for decades, right, that although women are the dominant workers, decision makers for their families, when it comes to health, they actually are the dominant users and spenders of money in the healthcare industry, but their own specific needs often are minimized and undervalued, and often women will, they'll take care of their family members before themselves. So where I believe we most need women decision makers is to push for more investment in women's health specifically. Women's health has suffered horrendously from really serious underinvestment for decades now. There's a article from 22 by McKinsey that told us or showed us that in 2020, just 1% of the $200 billion spent on biopharma R&D went towards female-specific conditions. So 1% out of 200 billion, and we're 50% of the population. So we need help here. And what this underinvestment has led to are the really shocking statistics in women's health that really prove this point. So I'm just going to take you quickly through a few of them. Over 100 women die globally every day from pregnancy and child-related causes. Maternal mortality rate in the US has doubled between 2002 and 2018, and black women are disproportionately affected. Black women are 3 times more likely to die from a pregnancy-related condition than white women in the US. We actually look kind of like a developing world here in the US as it comes to maternal mortality. Preeclampsia, a hypertensive condition, kills about 76,000 women per year, and it's still treated with magnesium that was used, 50 years ago. We don't have a proper drug for that. Preterm labor, that affects over 15 million pregnancies annually. We really don't have any treatments that really work. Menopause, huge problem. We've got a few things that are mostly hormonal, but in general, like we need people sweating out there. And then 1 in 10 women of reproductive age is estimated to have endometriosis, and we still don't have a cure for it. We actually still don't really understand the disease itself. So you can see, right, major issues. And underneath this, what I believe is that there are major factors that have contributed to this. Stigma is a serious problem. We don't tend to talk about, I heard you talking about, we don't tend to talk about the issues that women deal with. And if women continue to be as silent as we are, how can we expect all those male decision makers that are out there to pay attention, right? They're going to go on to something else before they focus on women's health. So we need to be the ones to bring this up and talk about it and get rid of that stigma that stops us from, describing when we're having an issue. With this minimal investment in women's health, we also don't know the science very well, right? Which means it's very difficult to develop drugs and medicines, right? So ultimately, we need to figure out how to develop proper medicines, right? And that also is going to take much more investment over time. I believe I am just about out of time, so I just wanted to mention one more thing. We are also seeing a growing number. I just want to show a little bit of positivity, right? So the good news is that women are starting to talk about their problems. They're starting to talk about infertility and all those tough things that it's been difficult to talk about over time. There is change happening. We're seeing a growing number of investment firms being founded by women, focused on women's health. We're seeing a lot of women's startups. Most of that has been about services and devices. We need more, certainly, on the therapeutic side. But what I can say is I'm optimistic. And of course, conferences like this, where we've got leaders, and we've got leaders who can definitely make it up to the very top roles, that makes me even more optimistic about the future for us. So, I would say, please, just a couple of suggestions for all of you. For those of you who are here as leaders, but may not necessarily be at the top yet, do the networking that you've been talking about, self-promote, apply for stretch jobs. Let people know that you are interested in coming, getting to the top. We need our allies, our males behind us, critically important. And then lastly, for those of you who are here who are already really senior leaders, continue to formalize that and continue to develop your own career and sponsor others, sponsor other women leaders. I think you've talked about that a lot today. Mentoring and sponsoring, I think, is the way to go here. And with that, I thank you so much for your attention.